Hello, everyone, and welcome to this week's Birth and Baby Talk. This is a topic I actually really like to talk about because it is something that people get a little bit sort of shy and feel silly talking about as adults. It's something we associate with children, and then we like to think that we outgrow it into adulthood, and that is needle phobia. So the official term for this is trypanophobia, and this is the fear of medical procedures involving sort of hypodermic needles or medical needles. In pregnancy, for a lot of people, this extends to things like IVs, epidurals, all of the things that we associate with birth and sort of medical procedures in birth. So this is something that affects up to 10% of the adult population. And I will say, as a doula, I think that that is probably an underestimation of the actual number of folks out there who experience needle phobias. And phobias can range from just like super nervous to complete avoidance. It doesn't have to be you fainting every time you see a needle or even an image of a needle. It can just be that really panicky feeling, even though you know you have to do it and you go for it anyways. Obviously, our goal as doulas and in sort of healthcare generally is to reduce these anxieties as much as possible. The reason for that is there's only so much you can avoid needles. They are things that we have to deal with sometimes. And in pregnancy, we have to deal with them multiple times over the course of the pregnancy and birth. So, as standard practice, we see blood draws early on in your pregnancy to confirm HCG numbers are rising and to confirm the pregnancy in the first place. Later on, we see blood draws for things like screening tests, as well as your gluten tolerance test when they're looking for gestational diabetes and other things further down the road. We also, everybody right now is talking about COVID vaccines. That's not the topic today, but it is a needle that people are being advised to get in pregnancy. As well, people are advised to get booster shots for their DTaP, which is their diphtheria, tetanus, and pertussis vaccine, and a flu shot during pregnancy. These are all recommendations made by the Society of Obstetricians and Gynecologists of Canada. So we, talking about these is in line with the current healthcare recommendations. Please do not come at me about recommending that people get vaccinations in pregnancy. We here follow SOCOG and the American as well. And so we do advise that people talk to their doctors and follow those health recommendations. But that means, potentially an additional 3 needles during your pregnancy. And then you get ready to give birth and maybe you're GBS positive, maybe you need to be induced or have your labor augmented. Maybe you just are ready for an epidural. More needles. And you also usually get a blood draw on admission to the hospital when you're giving birth because they want to just double check for things like your platelets and your iron levels and all of that, as it can be important information after you give birth if something is maybe not, you're not recovering the way they would like to see you recover. So what are some ways to overcome a needle phobia? As much as we name this episode Overcoming, it's really more about managing. It's hard to imagine that in a period of time where you are already dealing with being pregnant and a changing body and all of the excitement and anxieties that come along with that you will be able to completely overcome any phobia, let alone something like a needle phobia. That said, there are some benefits to managing and working with this condition in pregnancy. And the first is exposure therapy. So this is, the idea behind exposure therapy is that when you're dealing with any kind of phobia, getting exposed in small or regular increments can be really helpful in helping you to manage your anxieties and your panic around those situations. The beauty of pregnancy is there are tests that we can't avoid, or most can't avoid. And there are times when, it just is part of the pregnant experience in Ontario. And so you're really getting a little bit of that sort of unintentional exposure therapy in that you are getting that series of needles, blood draws, and vaccinations over the course of your 40-ish weeks of pregnancy. So exposure therapy is often, when we're talking about phobias, the first place we start. Like I said, the beauty of pregnancy is that exposure therapy is already kind of built in. The next thing I'm going to suggest is therapy generally. I am a huge proponent of therapy. And for a lot of people, their fear around needles comes from a traumatic experience, whether it is their own traumatic experience with needles or the medical system in general, or family experience. We often sort of discount the generational experience, other family members' experience, but that can absolutely impact how an individual is experiencing or thinking about or planning for medical procedures. And needles are a big part of that. So there are definitely individuals, families, communities where sort of the medical establishment and the procedures of the medical establishment carry a different kind of weight. And for those individuals, having someone who understands sort of community trauma, generational trauma, family trauma can be really helpful in addressing specific situations that have led to your individual phobia around needles. Now, in addition to that, even if it's just a personal experience or there's nothing in your history that, indicates a reason for a phobia, phobias and anxieties often are not logical and are not within, you can't say, I know exactly why this has happened and how I can overcome it. That's not how a lot of anxieties and phobias work. So for those people, even just seeing a therapist and talking through, therapists are well trained in a variety of coping mechanisms and can give you some specific tools for helping in the moment. Another specific form of therapy that has been shown to be particularly effective for needle phobias is actually what's called solution-based hypnotherapy. So obviously this is a form of hypnosis. I know hypnosis can make some people feel nervous, but we do actually have studies that have shown hypnosis can be really effective for things like overcoming fears and phobias, and for things like quitting smoking and even weight loss. For some people, hypnosis can be quite effective. So we know that hypnosis and hypnosis therapy has a basis in science and has a basis in sort of human behavior and psychological patterns, and it can be very effective in helping an individual to really sort of address and overcome a needle phobia in therapy. The other nice thing about hypnotherapy is it's sort of a low intervention type of therapy. There's no, extra needle jabs or something from an exposure therapy standpoint. And there's, it's for a lot of people, it feels like a gentler way of overcoming that particular fear. Now, outside of getting professional help, because, as a doula, I can tell you professional help is a huge benefit, but it's not right for everybody and it's not feasible for everybody. And right now with COVID and everything else, it can be a little bit harder actually to find a therapist that can meet your needs, because therapists are just very, very busy right now. A lot of people are struggling with their mental health. And so therapists and counselors are often quite busy. It can be a bit harder to get in to see someone who can help you. So what can you do on your own that doesn't involve bringing in another person to help you with this? This is actually really fantastic if you don't have time. So if you're due in the next couple of days or weeks, you don't have time to build a relationship with a therapist and start addressing these issues, you really need to sort of get on things now. The first thing you can do, I'm going to go back to that hypnosis. If you do a Google search for hypnosis for needle phobias, there are a ton of websites out there that provide either free or paid programs for at-home sort of guided meditation, guided hypnosis around needle phobias specifically. These programs exist. They're out there. There's some on YouTube. There's some that are directly through their websites that are paid programs, very similar to something like hypnobirthing or hypnobabies. Same idea. You get a series of tracks that you download and listen to on repeat, and then you do sort of the homework associated with it, and that can really help you to overcome it. If that's not your jam, if you're still very skeptical of hypnosis, that's cool. There's still things that you can do, although these are less about overcoming that fear and more about managing your responses to it in the moment. So the first thing that you can do is actually tense all of your large muscle groups. So this means your arms, your legs, and your torso. I know that torso at 9 months pregnant might be a little bit harder, but tense your major muscle groups. This feels very counterintuitive to a lot of people. And even the medical and healthcare providers you speak to will say you want to be relaxed so that your veins are open and things flow really well. And that's true, But when you tense those large muscle groups, you actually cause a slight spike in your blood pressure, which can prevent or help to minimize the vasovagal response of a low blood pressure, which is what often makes people feel nauseous, dizzy, or faint. So we are trying to counteract that drop in blood pressure from that vasovagal response. And so we do that by tensing our muscle groups. The other way to avoid a vasovagal response, and this is something less about needle phobias, but I talk about this with partners all the time, is a vasovagal response, which is that lightheadedness, that dizziness, is much more common if you are dehydrated or your blood sugars are low. So outside of your glucose tolerance test, not gluten, that's a whole other test, but outside of your glucose tolerance test and gestational diabetes, try and go into your tests having had, a proper breakfast or meal leading up to it. Make sure that you are hydrated. This is really true for labor. One of my first pieces of advice when a client calls us and says, okay, I think I'm in labor is, great, go drink a bottle of water. And then go take a nap. That's the next piece of advice. But it's really important to stay hydrated for a couple of reasons. One is to help with that vasovagal response. The other reason is dehydration causes your veins to shrink and narrow, and that can actually make it harder for a nurse or an anesthetist to get your vein or get the right spot on the first try. And obviously part of minimizing your fear is minimizing the number of times people need to jab you. And so we don't want to be dealing with really hard or narrow veins. We really want those veins to be open and easy for the nurse to get an IV in or to get a blood draw done. So again, keeping hydrated, keeping your blood sugars up, that can mean, a sports drink or coconut water. It can be regular water and a snack. Doesn't really matter. Just make sure that you keep your blood pressure, or not your blood pressure, your blood sugars and your hydration up. The second thing you can do, this is a trick. I stole one of my kids' socks. We're not going to tell them that I have stolen one of their socks. So this is actually one of my favorite tricks for people who just the sight of needles and IVs totally freaks them out. You want to cover it. And I know that seems really simple, but it's just we want to cover, and it's so out of sight, out of mind as much as possible. So the first thing you're going to do is take a sock. Now this is a child sock, which is a good size for a lot of people, but you can also use your own sock. So what I'm doing here is I'm just cutting off the toe. Now, depending on where your IV is, that might be enough. You might not need to do anything else. And then you just pull the sock over top of the arm that has your IV in it, and this covers it up. Now, the reason I said it may or may not be enough is for those people who end up with their IV in the back of their hand. This is what we see with Hollywood all the time, but it's not always the best place for an IV. But if it's in the back of your hand, you may want to cut a second hole in your sock for your thumb. And I just do like a quick little, just a line. It doesn't need to be cutting anything out. And then it's a bit more like a fingerless glove, and it will keep the sock or the covering a little bit further down on your hand. It prevents it from rolling up as much as if you didn't have that thumb hole. Now, you don't need to do that if you've been able to get your IV put into the side of your wrist or another part of your arm. That's true also if they've needed to put the IV up further. You just slide the sock or the covering a little bit further up. If you forget a sock or you forget scissors or you don't have what you need, even just asking the nurse for a bandage and some tape to cover it so it's out of sight, out of mind, can be one way to manage that. The other thing, and I just sort of alluded to it, is try and sort of speak with your nurse about IV placement. This is another way that hydration comes into a big factor here because we want to have those nice big open veins. So I am clearly dehydrated because my veins suck at the moment. Most of the time, we think of IVs as going in the back of your hand. And that's not a bad place for an IV. It's much easier for nurses in a lot of cases to get the IV in, and it's easier for them to access. That being said, for people that are moving in their labor, who want to be leaning on the bed, leaning on a wall, draping themselves over a birth ball, and for later when they're breastfeeding and they're using their hand to move, An IV tube in the hand can be extremely uncomfortable, and that makes the out of sight, out of mind a little bit more difficult. It can also it truly be painful, not the same as sort of labor pains, but a pain that people become very aware of. And if you have a phobia around needles and IVs and that pain, it can feel even bigger and more painful than it actually is. So for those people, asking your nurse to look at veins in other places can be very, very helpful. As a doula, one of my favorite places is to ask the nurse to look at the veins in the side of your wrist leading into your thumb. This is a really good place for IVs because you're not moving your hand in this, like the sideways direction as much. That's a really awkward way for most people to move their hands, and it's not something they do frequently. So in labor, most of your wrist flexing is forward and backwards, not side to side. By having it in the side of your wrist, you're avoiding some of the discomfort that comes along with that movement. Obviously, that's not always going to be possible, and your nurse may not be able to do it, but it's worth the conversation. The last point I want to make is about the conversation. This is a huge piece of this, and it is so important to address with your healthcare provider. Everybody who is on your birth team in the moment should know that needles and IVs and epidurals and all of that is a source of fear and anxiety for you. You don't want to spring that on anybody in that, like, you have a panic attack as, say, anesthesia is putting a lidocaine injection in your back before they insert the epidural. You know, that's not necessarily the greatest time to be really anxious. You want the people around you to help you through this process. So when you get into triage, it's really good to discuss the situation with the nurse, even more so once you get transferred to a birthing suite and you have the nurse who will be your nurse for the next however many hours. So you really want to have this conversation with the nurse. And really, when you talk to the nurse, sort of have a good idea of yourself. Do you do better with needles when you are told everything that is happening every step of the way? Or do you do better when you look away and you don't know what's happening and they just do it and get it over with? Different approaches work for different people, but if you know what approach works best for you, talk to your nurse about it. I've seen some nurses who are really chatty. They, you know, the standard in healthcare is to inform the patient of what you're doing as you do it. And so they might be talking through the procedure, and I've had clients who are like, I don't want to know this. I don't want to hear about it. Don't tell me what you're doing. Just get it in and like stop. And so it's helpful to have those conversations before the needles come out. And that way your nurse can really help to manage. They can also, you know, try and do things so that you're sitting and your body is angled away. You know, your arm can be back here and you can be facing your doula or your partner or something on a screen or anything else. And you can avoid sort of even being almost in a way a participant in the procedure. But really talk to your nurse. They often have ideas. They've dealt with this before. Many of them are very, very well informed on how to manage a needle phobia in the moment and in the room. And they really want to help you. They're there as your, not your friends, but they're there as your allies and advocates. They're there to be a support as well. Medical support, but a support. And they too want you to have a really positive experience. And if there's something that they can do to alleviate that fear and alleviate that phobia, they are happy to do it. They really want to work with you to achieve that positive outcome. Hopefully all of this was helpful. I will say I had a huge needle phobia going into my first birth. I am definitely one of those people who have medical trauma in my background. And so for me, needles were a huge representation of some medical difficulties I had in childhood. And, that carried over. I avoided needles. I avoided vaccinations. I avoided my flu shot. I avoided all of it until I was pregnant with my first. And for me, the exposure therapy that is pregnancy worked to an extent. But I also did some of these other tips and tricks. I didn't know about hypnotherapy at the time. Now I don't really need it. Now I just sort of say, jab me, don't tell me what you're doing, and I'm fine. But it definitely took both of my pregnancies to get to that place where I am comfortable. Another reason I want to, it was really important to me to talk about this is because not only do people with severe needle phobias avoid medical procedures for themselves, which can be particularly concerning in pregnancy, we do know that parents with needle phobias are more likely to avoid medical procedures, in particular vaccinations, for their children. And so obviously this becomes a thing where our personal fears are impacting the care that our children receive. And I'm not saying that to condemn anybody. These fears are legitimate, they are real, and they are valid. And it makes sense that as parents, something that causes severe anxiety in us is going to at some point sort of spill over a little bit onto our child, whether it's they pick up on our anxieties or if it's just that we avoid those medical procedures. But it's really important to sort of overcome that personal fear in order to ensure that children are receiving the best possible medical care in line with the recommendations of their pediatrician or family doctor. So working through those sort of fears and phobias and learning to manage those fears can be really helpful both in pregnancy, but also postpartum and in parenting. The needles for kids are more frequent than we're used to as adults because they have to begin their vaccination schedule right from sort of the beginning. So we definitely see, parents who delay or avoid certain procedures and well checks because they're worried about this particular thing. And by overcoming and addressing it in pregnancy, it can lead to just better sort of medical care long-term for both you and your child. So hopefully all of this was helpful, and these tricks and tips that I have given you will help you overcome. If you had something that you did that was really helpful, please tell us in the comments. It's always amazing to see the things that work for specific people or specific ways of managing this fear that other people have found helpful, and that can help everybody. So please feel free to share your experiences in the comments. We don't have a current topic for next week. Our schedule for this month got a little bit moved around because a guest that we had planned had to reschedule, but Leanne will be here next week to chat with everybody, and you can, I'm sure, both follow all of our social medias to find out what it is a little bit closer to the time, but also just tune in next Wednesday at noon to see what Leanne has to say. She is always a fountain of information and facts and wonderful news. So she is always worth tuning in and watching so that you can get your fill of birth and baby talk. Thank you so much, everybody, for joining us, and we'll see you next week.